and Dr. Vijay Geeta from AIMS Nagpur. So they all have a wide experience in writing papers. And Dr. Parnivel from JIPMER, he is going to join us for the next module. All of them have a wide experience in publishing papers, and they have good experience as peer reviewers also. So they would just give us their experiences and how to write and how to go about in the entire process of writing, reading, and submission. So, and also to give the highlight, they all have more than 60, highest maybe even to more. Dr. Parnivel has more than 250 papers to his credit, and Dr. Hemant, I'm unable to count. So they're all with a good number of papers. So it is only our participants who have to take the initiative to interact with our facilitators to get the maximum out. So they will give us the run through today. We have designed the module such a way that module 1 is going to impart knowledge. It is just going to tell you all how and what to write in the manuscript. So module 2 is going to tell us about, going to give a bird's view about all the statistical analysis, and we are going to majorly concentrate on the analysis that is much required as an oncologist or healthcare professionals. When we read a paper, what things have to be observed and put into our practice. So this module 1 and 2 is going to give a great view on how you're going to read the paper, and Module 3 is going to be more of the enactment of the Module 1 and 2. So Module 3 is going to be, we will just divide you all into groups, and whatever knowledge that you have got in Module 1 and 2 will be applied there, where you will all get into groups and read through the specific papers assigned to you all, and then we will have the plenary to make the presentation. So I request all of you all to have keen attend 3 modules. So now I welcome Dr. Hemant, who is the first facilitator for our sessions. Over to you, Dr. Hemant.
Thank you very much, Dr. Niremati. Can you please confirm you can hear me well?
Yes, doctor.
Excellent. Thank you, Dr. Shashi. Thank you, Dr. Niremati, and hello to all. I see many familiar colleagues of us in the participant list. Now, I request, may you please turn on the screen sharing. It says host as disabled, participant screen share. Over. Yeah, it's working now. Excellent. Before I begin, Dr. Niremati, once more, can you confirm you can see the
Yes,
screen?
we are able to see, Dr. Hemant.
Excellent, excellent. So again, thank you all to the organizers for inviting me. So to all the participants, this first lecture is going to be for 45 minutes. This is about the principles of, manuscript writing. If you have any comments or any questions, I request you all to please note them down. And at the end of the session, you will get the opportunity to ask questions or make comments. So what we are going to go through is, the process of publishing. The more focus is going to be about manuscript writing, specifically what editors and reviewers specifically want in manuscript. I'm going to only share the principles, the practical aspects, and the hands-on experience you will learn as you go on this modular training. So before I begin, I'm Hemant. I'm from ICMR NIE, and hello to all from Chennai. Before I begin again, to acknowledge, these slides have been taken from the Structured Operational Research Training Initiative lectures. Structured Operational Research Training Initiative sorted is a WHO TDR coordinated model of building capacity in operational research in health program and in health settings. Okay, let's begin. Now, before you start writing any manuscript, the golden rules is that you need to choose your journal before you even start writing. The reason being, each scientific journal has its own guidelines, which includes word count, which includes font size, which includes font type, which also includes things like spacing between lines. It also includes what is going to be the structure of the manuscript. So please first identify the journal before you start writing. Print off the journal guidelines, go through them, make a note of the key points, and follow them while you write your manuscript. The other way around is we write the manuscript first, and then we explore journals, and then we realize, gosh, my manuscript is of 4,000 words, but the journal that we have selected is saying that original article should be 14,500 words. And then you have to again work towards reducing, cutting down your article from 4,000 to 2,500. So, golden rule, please choose your journal before you start writing. Now, when you choose a journal, it depends on the audience. So, what's your audience and what is the journal's audience? Then, what are the interests of the journal? Whether your topic is of interest to the journal, whether the journal is listed in PubMed, because PubMed is one of the common search engines that's used to search for scientific literature. Then, what's the impact factor of the journal? What is the turnaround time? That is from submission to first response to one or two rounds of review followed by eventual publication. This is the turnaround time. Whether your journal is open or closed access, and many times we also go. So see, I come from an operational and implementation research background. So for me, it's very important that the journal should be out, the article should be out very soon. So for example, if I worked on an operational research paper in oncology, where in a cancer hospital, we have looked at how patients are followed up after treatment completion, and we identify many gaps in how patients are followed up and how the data is recorded. And because there are gaps, we are not able to generate meaningful information on overall survival data. So my paper could be about the gaps in documenting follow-up data or survival data, and we are giving some recommendations based on our operational research. Now, if you want your findings to be implemented on the ground, many a times, once you have a published paper, people tend to take it more seriously. Now, the problem that you have in your hands is today, if the paper gets published after 2 years, it's of no use. Because at the end of the day, for me as an operational and implementation researcher, the priority is policy and practice impact. That is change to happen either at policy or practice level, so that there is some change on the ground which eventually benefits the patients or the population that is served. So for me, who is working in operational and implementation research, 2 points that are very important is that the turnaround time should be short and the journal should be listed in PubMed so that whenever someone tries to search for my article, they will easily get it. Other factors may not be that important for me, but for someone who is an academician, where publications determine their promotion, for them maybe impact factor becomes very. So whatever it is, based on your requirement, please choose the journal appropriately and finalize your journal. Understand the journal's writing style in advance before you start writing your article. Again, within the journal, check for the types of article. Each type of article, there is a word count, the number of tables, figures, and the number of references. There is a limit to it. So please decide what type of article, and accordingly structure your article in line with journal guidelines. Now, again, follow a clear structure when you write. These are general guidelines which are irrespective of the scientific journal you choose. Most of us, if you're going for observational studies, you're going to follow stroke guidelines. And if you're going for randomized control trials RCTs, you may go for consort guidelines. So please go through these guidelines and follow them when you write your manuscript. Now, before I go to the principles of manuscript writing, This cartoon is very important, right? For all of us to understand that in the chart you can see is the proposal. In the proposal, we had thought that this is what our final product is going to be. But after we collect data and we analyze our data, we realize what we get in reality is the rocket on the right hand side. So many times, despite having a very good proposal, once we collect and get our data and once we analyze the data, we realize maybe we are not able to answer all the objectives, or we are able to answer the objectives, but there are some limitations in our data. In that case, it is okay. Do not worry, but it's good that you document what are these limitations and mention it in your manuscript. Now, the structure is of any manuscript. I'm going to go for a original article. The structure is introduction, methods, results, discussion, which is what we call as IMRAD format, which is intro, methods, results, and discussion. Then some journals would say that conclusion has to be a separate subsection. Some journals would say conclusion should be a concluding paragraph, that is the final paragraph of discussion. Then we also have bits and pieces, that is things that come before introduction, that is your title page and abstract, and things that come after the conclusion, which is the acknowledgement, funding, it could also include conflict of interest statement and many other things, data availability, supplementary materials, and finally ending with references. So in introduction, you say why you started the study or why you did the study. In methods, you're going to describe what you did. In results, you're going to describe what you found. And in discussion, you're going to mention what it means. So whatever results you have presented, what do they? Now let's go through each section of an article one by one. Now, when you write the introduction, okay, now before I begin, I would request the participants just note these points down because, whenever writing is difficult. So if you have these subheadings in your Word document and then you can fill one paragraph under each subheading and then remove these subheadings, then you have your introduction, methods, results, discussion. So I request the participants to please note these things down. Now, these are only general guide. There could be some minor modifications, but broadly speaking, if you follow these general guidelines or principles, and if you cover all these points, your editors or reviewers would be generally happy with your manuscript. So in introduction, the first paragraph is usually about setting the scene regarding what is the general problem. Are you talking about tuberculosis? Are you talking about cervical cancer? Are you talking about non-communicable diseases? Are you talking about community-based screening of cancers? Are you talking about say, accidents and, linkage to care within the golden hour of, accidents, are you talking about, again, cardiac events, acute cardiac events? So whatever it is, what is the general problem that you're talking about? So usually we talk about the global and the national and the local burden. Once we clarify what the general problem is, we get to the specific question that we are interested. Within oncology, what are you talking about? Within that cancer, are you talking about prevention? Are you talking about treatment? Are you talking about follow-up? Are you talking about in clinical setting or programmatic setting? And what is the specific question to be addressed? So what is the area around which you're planning to do your research? Once you set the scene and get to the specific question to be addressed, you are expected to summarize the latest research as to what has been done, what are the problems with previous research, what are the gaps with previous research. In other words, what is known and what is unknown, therefore you know what is the gaps. And to address those gaps, you say that this is why we are doing this study. If possible, please market your study at the end of the introduction. If there's something new, something novel, you can say after you do the review of literature, after you have identified the unknown or the gaps, you may say to address these knowledge gaps, this is the first ever study looking at. So this is a good way of marketing your study. The last paragraph of your introduction are your objectives. Either you may decide to give the broad aim or you may decide to give specific objectives. This is the last paragraph of your introduction, which is again in running sentences. It is not in the form of bullet points. Please remember, in proposal, usually your aims and objectives are a separate section other than introduction, and they are in the form of a bullet point. In manuscript, it is in the form of paragraph, and it is part of the introduction, which is the last paragraph of the introduction. And generally, we either write the objectives or the aims. Now, again, this is about writing style. When you talk about the gaps and what is unknown, you may say, to fill these knowledge gaps, or to understand this better, we aimed to understand this, where you can give the aim, and then you can say specific objectives were 1, 3 in the running paragraph. Now, one point to note in your introduction is, please do not oversight. See, whenever you're talking about the general problem, when you get to the specific question, when you talk about the latest research, when you write about what is known, unknown, you need to give references. Please give relevant and recent references, and do not oversight. Not more than 10 to 15 references in the introduction. Generally, it is 30 references in an original article. So please do not oversight. And if possible, if there is a systematic review which is synthesizing all the evidence, it's better to cite this systematic review rather than citing each and every study that has been included in the systematic. So once you have written the introduction, that is why you did the study, the next section is about what you did. Now, in methods, these are the subsections under the section methods. First is the design. What is the study design? Then you describe your study settings, followed by your study population, then variables and sources of data, followed by data entry and analysis, and the last paragraph is ethics approval. Now, in design, you just need one line, which is the study design and whether the study involved primary data collection or secondary data collection. For example, this was a cross-sectional study involving primary data collection. This was a case control study involving primary and secondary data collection. This was a cohort study involving secondary data collection. So please note, we avoid the words retrospective, prospective, or ambispective, because at the end of the day, everything is retrospective 10 years down the line. So Strobe guidelines suggest avoid the use of the word retro, ambi, or prospective. Just mention the study design, cross-sectional, case control, cohort, descriptive study, ecological study, then involving primary or secondary data. This is for observational studies. Then for randomized control, you may say this was a randomized control trial on primary data collection. Within randomized control trial, you can talk about blinding, whether it was level 2, level 3, level 1, or what the number of blinding that was had. Next comes the setting. It's very important to describe your settings in general. Specifically, if you're doing the study in a hospital setting, or if you're doing the study in a health program setting, this is more common for operational and implementation research. You need to describe for your specific research question or research area that you're working on, what is the routine management of the patients, or how are patients managed in your program? What is the routine data capture? What is the routine monitoring mechanism? Who are the people involved? Which are all the records involved? So it's important to describe everything in the setting. But please note, do not write 2 to 3 pages of setting. Just half a page or 1 page of setting should suffice. You may also use flow diagrams or box to summarize key things like patient flow, or if you have to describe some SOP or standard guidelines, treatment guidelines, or you want to describe some operational definitions that are routinely used. Please note, whenever you write the setting, make sure you also compare it with the introduction. There should not be any overlap of information. If you have mentioned it in introduction, avoid repeating it in the setting. If you have mentioned it in the setting, avoid repeating it in the introduction. The next section is study population, where you describe who your study population are by time, place, and person. Now, if you're doing sampling, then within this you need to describe how did you do sampling. That is, you had a target population. From that, how did you get the sample? What kind of sampling did you follow? And a paragraph about sample size calculations. Now, sometimes sample size calculations are also mentioned under data entry and analysis under a separate section called statistics. Some people put it under study population. However, if you're doing study in hospital or health program settings, and within a time frame, if you have included all the patients, you can just say all people registered into care between this time to this time in this hospital, were included in the study, and some inclusion or exclusion criteria may be wide. But please remember, mention the study population by time, place, and person. And usually, you need to clarify how you built your cohort, whether it is based on date of treatment, date of registration. Because when you say all patients during a time period, that time period, the patients could be identified either based on whether their date of diagnosis lies in that time period, or whether their date of treatment initiation lies in that period, or it could just be the date of hospital visit, first hospital visit. So absolute clarity as to your description of study population in terms of time, place, and person. Now, if your study involves primary data collection, then after the study population, you may have a, paragraph called as procedure, where you can describe what you did to collect the data. If your study involves secondary data, then you have already described in your settings how routine patient management, either for prevention or treatment or follow-up, whatever your study's focus is, how routine data capture happens. So you have already explained that in settings, so you don't need to have a separate procedure paragraph. So depending on whether you have primary data collection or not, you may have a separate procedure paragraph after study population. Then comes the variables. Under variables, you just mention the key variables and what are the sources and how data collection was done, how it was validated, and if required, if there are any operational definitions, which you think have to be included, you may include them here, or you may also decide to include them in the settings. For example, if operational definitions of treatment outcomes is part of your routine care, I would say put it under settings. If you, for your variables, after collecting them, you decided on some operational definitions specific for your study, you may include it under variables section. Then how data entry was done. Once you collect your data, if it is electronic, you just say data. If secondary electronic, you just say data was extracted, cleaned, and analyzed using this software. If it is secondary paper-based data, you need to say how data entry was done, whether double data entry and validation was done, or whether it was single entry, which software was used, and which software was used for analysis. If it is primary data collection, again, did you do mobile-based data capture where you just, collect data in a handheld device and data is already available in an Excel sheet to download where you clean it and start analyzing? Or if it was again paper-based data collection, how data entry was done and how analysis was done. Again, in the data analysis section, specific to your objectives, you need to clarify what all are your summary statistics. That is, whether it is mean, median, depend if the objectives are descriptive, if objectives are analytical, whether it is difference in mean, difference in proportion, relative risk, odds ratio. So, what summary statistics are you using, and then what appropriate statistical tests did you use? Finally, ethics approval. When you're talking about ethics approval for secondary data, we usually write that ethics approval was taken from this ethics committee and they approved the waiver of written informed consent. If it is primary data collection, you need to say that ethics approval was taken from this ethics committee and written informed consent was taken, and this process of consent was approved by the ethics committee. Now, this is about methods, about what you did. Then comes to your results section, which is what you found. Now, quickly in your results section, it's very common. I've seen many papers in which results are haywire. Everything under the sun is getting analyzed, and so many results are being provided. that the reader loses focus. So when you write your results, please copy paste your objectives. If you have 3 objectives, 1 paragraph for each objectives, and please only present your results in line with your objectives. Therefore, when you are analyzing your data as well, stick to your objectives and stick to your data analysis plan, which is already there in your proposal. So you usually begin with total people enrolled or included in your study. If you're doing an interview, what was the response rate? Was the non-response very high or it was very minimal? And among those finally included, you describe them socio-demographically and clinically. And then you provide the outcomes, numbers, percentages, mean, median, with or with relative risk, odds ratio, hazards ratio, difference in mean, difference in proportion, along with the p-values and confidence interval. Now, in yellow, I've mentioned the additional principles you need to follow. In results, please provide only the facts, the number, percentages, the relative risk, CI, p-value. Do not infer the results that there were lot of males or there were males were the majority. No, just say of 700 study participants, 600 were male, and in bracket you put percentages. Please do not infer the statistic. Just state the facts, nothing but the facts, without any inference in the results. Now, avoid duplication in text and tables. You will be having some tables and figures. Please avoid duplication. You don't have to tell everything that is there in your tables and figures in the results narrative. Just stick to your objectives and only mention those results in the text. Your tables and figures of your results should be standalone. That is, even without reading the results narrative or the paper, you should be able to infer the tables and figures. That is, having a clear title with time, place, person, having a good table following the structure of a table, and providing appropriate footnotes. Again, in statistics, as shared, only report planned outcomes. Additionally, in the results, there is a writing style. Some people usually give the numbers and percentages. Or some first giving the people enrolled, total study participants enrolled in your study, and for every result providing the number, percentages, or the relative risk and CI, or the OR and CI, or other people, instead of presenting numbers and percentages, they just provide the percentages. So it is more of a writing style. What I prefer is to provide numbers and percentages everywhere. If you just want to write percentages in your narrative text, please provide the numerator and denominator in the brackets. Now coming to the discussion. Now this is the most difficult part of your paper to write. Basically, in your discussion, you're going to write what these findings mean. That is, whatever you wrote in your results, what does it mean? Now, there are some subsections again within the discussion. I'll read these subsections one by one. So again, like any other section of the paper, I just copy paste these in my Word document. I write one paragraph under this, and then I remove the headings. That's how I also write. Even I cannot just start writing on a blank piece of Word document. Usually, whenever I start writing, I put those headings, I copy paste these subheadings, and I start writing within them. Now, the subheadings and the discussion or the key topics or the key principles that you need to include are: what are the main findings of your study, which is the first paragraph? What is new? Why it is important? The strengths and limitations of your study. Next, comparing each of your key findings to the literature, explain differences, some speculations. Then for each of your key findings, what are the policy practice implications, followed by recommendations for future research. Now, the first paragraph of your discussion basically summarizes your results narrative, the whole of your results narrative and tables and figures into a single paragraph with maximum 3 to 4 lines, where you just say what are the key findings of your study along with some inference. For example, this study found high prevalence of HIV among my patients attending OPD in my clinic. Or this study found an association between socioeconomic status and poor treatment outcome. And this was specifically, the association was stronger in this subgroup. So whatever is your main finding of your study, please write it in a single paragraph, not more than 3 to 4 lines, and do not repeat the numbers in this paragraph. You are just going to infer. No, don't repeat the numbers and percentages. In other words, this is a layperson summary of your results narrative in the first paragraph. Now, again, maximum have 2 or 3 key findings in your first paragraph. Do not write one long paragraph with 10 findings. If you're writing 10 findings, either you're highlighting unnecessary findings, or maybe you need to break up your paper into 3 or 4 different. Now, after you write the main findings of your study in your first paragraph, you can write the strengths and limitations. So within the strengths, I write what is new and why it is important and what are the strengths of the study. Again, if you have already written in your introduction, in this first ever study we aim to find, then you don't have to repeat this here. Again, regarding writing styles, some people write strengths and limitations at the end. I strongly recommend and follow that we write strength and limitation at the top, so that whatever discussion follows, I will keep in mind the limitations. If not, we will have a detailed discussion about the relevance of our findings, the policy practice implications, and write these will change the program. These guidelines are these findings have great implications. It will change the way we manage patients. And then if you write limitations at the end, and you will say that there was a major limitation, that 85% of the patients did not respond to our questionnaire. So our findings are not generalizable, or there's lack of internal validity. Forget even generalizing your findings. So it's important that you be honest and put your strengths and limitations upfront, so that your tone of discussion will be guided by your strengths and limitations. So your first paragraph is about the key findings of your study in layperson summary, maximum 2 or 3 findings. Do not repeat the numbers or figures from the results. Then in your strengths and limitations, to start with what is new, what is important, if this has not been repeated before, then provide strengths and your limitations. Then whenever you give your limitations, also say, as a result of this limitation, how have your findings deviated from what would be the reality? For example, if you get a relative risk that those from poor socioeconomic status are 3 times more likely to have unfavorable outcomes, that is a relative risk of 3, then if in measuring the socioeconomic status, if there was some bias or some limitation, if that limitation would have been addressed, would your relative risk move away from 3 towards 4, 5, 6, or would it move towards 2, 1? You know, your limitation is important. If the limitation, if the limitation was addressed, your results would move towards 1. Then that's a major limitation. But in the absence of a limitation, you may say our estimate of relative risk is conservative. And if that limitation would have been addressed, our relative risk would have been more than 3. So more than 3 means your inference doesn't change, right? Those with socioeconomic status, poor socioeconomic status, are more likely to have unfavorable outcomes. So accordingly, you need to discuss your limitations, whether it would change if those limitations were hypothetically addressed, would have been addressed a priori, would your inference of the final results change? Then, for each of your findings in your third paragraph, you start with comparing your findings with literature and explain differences. So, say you have 2 key findings. For finding 1, you write a paragraph comparing it with literature, inference of those findings, comparing it with literature, and why you found those differences from other literature. Then again, second paragraph for comparing your second key finding with literature and explaining differences. So till now, we have had 4 paragraphs. First paragraph describing the main findings. Let us say there are only 2 findings. The second paragraph talking about the strengths and limitations. Then the third paragraph discussing the first key finding. The fourth paragraph discussing the second key finding. Now, if your strengths and limitations are too many, then you can break your strengths and limitations into different paragraphs as well. Then you have the policy and practice limitations, implications. what are the clinical implications, and what are the program and policy implications. Then, whether they will be politically acceptable, okay? Then, what are the operational feasibility of implementing those recommendations or implications? Are there any budgetary implications for those, recommendations? And what is the predicted programmatic, clinical, or public health impact? So this is where you discuss your policy and practice implications. In other words, these are your recommendations section. You may decide to have one or two paragraphs depending on the number of implications or recommendations that you have. Finally, you may provide a paragraph on future research. In your introduction, you provided what is the gap. You address that gap, and you filled that gap through your study. In addition, still there could be a need for future research, right? So what is the recommendation for future research? And finally, coming to conclusion, your conclusion may be a last paragraph of your discussion, or it may be a separate section, depends on the journal guidelines. Please keep your conclusion short and simple. You basically add 3 lines: what you did, what you found, and what you recommend. Just 3 lines, to conclude your article. Now, sometimes people get confused with the first paragraph of your discussion, where there is a layperson summary of your results narrative and your conclusion. Many researchers or authors find these two paragraphs to be similar, and they feel, are we repeating the same thing in our conclusion? Please note, conclusion is basically your first paragraph of your discussion, inferred in line with your strengths and limitations, inferred in line with comparison with other findings, inferred in line with the policy and practice implications. So therefore, you are going to write what you did, basically a 1 line on methods, or 1 line on your aims. Of you may basically write your aim, the more layperson style, what you found, and what you recommend. Please note, your recommendations here, which you have already discussed, should be in line with your objectives and your data. Please do not, for example, I'll say, you find that, again, socioeconomic status is a risk factor for unfavorable outcome. Then you start discussing that we need strategies to address the poor socioeconomic status. Clinics may consider giving some kind of coupons or vouchers to reimburse for the travel, or to reimburse for the indirect costs incurred by the patients. Then you can say we need studies to assess the effectiveness. Future studies may look at effectiveness of these strategies. So in your recommendation, it should not be around that these strategies should be implemented, because you don't know whether these strategies would work. You may just say in your recommendation that future research may explore the use of strategies to, address this risk factor, that is poor socioeconomic status. Do not get excited and say that we have to implement these strategies unless your study showed that these strategies are effective in addressing that problem. So please, your conclusion, again, see whether it is supported by your data, whether it is in line with your objectives. Now, before I end my session with some 2 or 3 slides on writing tips, this cartoon, which shares the importance of writing. So you have these sailors who have reached an island, and the captain of the ship says, "Look, look, gentlemen, purple mountains, spacious skies, fruited plains. Is someone writing this down? Because if you don't write it, this finding will die with the captain. If the captain or his team writes it down, it gets published elsewhere, then it gets documented." That's the importance of writing. Now, some tips about writing. All of us should strive towards clarity. Please remember, scientific writing versus communicating. When you do scientific writing, please minimize jargons. Jargons are technical terms which you may understand, but depending on your audience, If your audience is, policymakers who are actually not clinicians who are working in that area, if you use too many jargons, a policymaker is not going to read your paper. Please use simple, familiar words. Use concrete words instead of abstract words. Keep your sentences short. Keep your paragraphs short. Don't have sentences running to, 4 or 5 lines. Don't have paragraphs running to 1.5 pages. Each paragraph should be discussing only one concept. Then avoid unnecessary and meaningless words, like we start sentences like, therefore it is found that, it is to be noted that, it is the case that, therefore this, therefore it is understood that. These all unnecessary, meaningless phrases should be avoided. Again, with respect to writing for clarity, consistency in use of phrases is very, very important. When you're using a phrase to denote something, please continue using that phrase across the article. Do not use different phases, because intro, methods, results you may write on different days. One day, your day might be bad. Your boss must have reprimanded you for some error of yours. And based on your mood, don't use start writing using different phrases. So please use consistent phrases throughout. Again, abbreviations, maximum 3 to 5 abbreviations. If you decide to use an abbreviation, please give the full form during the first use of the abbreviation. After that, please use the abbreviation. Don't again start using the full form, right? So these are some tips for writing for clarity. Again, whether you want to use active or passive voice, look at journal guidelines and maintain consistency. Avoid abstract normalizations. Be careful with, emphasis words. Usually avoid really, most, very important. This is extremely important. So avoid, because if your study is not strong, if there are many limitations in your study, maybe you're overemphasizing your results more than, or you're biting more than you're biting more than you can chew. Then less is always more. Even if your journal guidelines say 4,000 words for an original article, try your level best to restrict your article to 2,000 or 2,500 words. No one is going to read an article which is 4,000 or 5,000 words, believe me. Check tense, past tense or present tense. In your article, everything is going to be in past tense because you have already done it. But for your settings, because in your settings, you're describing what is happening and what is also currently the process or the procedure, right? Or currently what are the guidelines followed. So mostly it is past tense, but for the settings, and you may use some tools like Grammarly or other softwares that are available to check the grammar of your, what you have written. Again, please, this is about cheating. Writing is a serious business. Uh, do not copy paste stuff from other articles. That amounts to plagiarism. Even if you're taking some idea from somebody else, you need to write it in your own words. You can't copy paste it, and then you need to provide the reference. In rare situations where the line used by the other author is really wonderfully written, you want to just use it as it is, or you want to use the phrase as it is, then it's always good to put it in quote unquote. Please do not fabricate, falsify data, changing the numbers just to get a significant p-value. This is bad practice. Do not submit to more than one journal at a time. Avoid ghost or guest authorship. Guest authorship means someone who doesn't fulfill the authorship criteria. You're offering authorship to him or her. Ghost authorship means somebody has actually done the work, but he or she is not part of the author list. Then avoid multiple publications from the same data. Avoid salami lines. Do avoid unfair citation of references. When you cite something, make sure you've read the whole report or you've read the whole paper. Do not cite simply by reading the title or reading the abstract. In abstract, it may be written that this was associated with that. But when you read the paper, you may see that there are major limitations in the paper. So you may even decide not to cite that reference. Again, if there are any competing interests, conflicts of interest, you should declare them in your conflicts of interest statement. Finally, the biggest enemy for all of us, including you and me who intend to write, including me, right? See, we are implementing a strategy called as Kasma Erpilla Tittam in Tamil Nadu. The impact paper is ready, but for the past 2 months, I have not been able to write because the results are ready because of my, busy schedule, you know, uh, but this is procrastination, right? It's been 2 months since the results of the impact are there. It's just that I have to write it. So writing is 90% procrastination and 30% panic. That is more than 100%. Procrastination means let me do it tomorrow. Let me do it tomorrow. Let me do it tomorrow. And again, writing requires you to give 5-6 hours of time. You can't just sit for 30 minutes, write, take a break, and some other day start writing. It doesn't work like that. You need to synthesize your ideas. You need to do review of literature. So you need 5 to 6 hours of fixed time to do any meaningful writing. So please, avoid procrastinating, and no one is going to come and inspire you. Start writing and do the process very quickly. Once your data is ready, analysis is done, write the paper within 2 to 3 weeks and share it with the co-authors for comments. So the biggest enemy in writing scientific literature is you and me. That is, we procrastinate. It is not some other third person. Again, do not look at the publication process as this. Many of us think editors and reviewers as someone who don't want our paper to be published. Please remember, editors and reviewers are all our colleagues who themselves are also authors. So please take their feedback constructively with the with this idea that the overall objective is to improve the quality of your paper. So please treat peer review process as an opportunity to improve. Thank you very much. Over to you, Dr. Nirmal.
Thank you, Dr. Hemant. I think you have just set the platform for today's module. Thank you so much. Over to the participants. I think few of y'all had a few doubts who raised up in the chat box. Can you all just open up and ask your questions? And I also request the participants to rename your login name so that we will know who is present from our list. Thank you. Participants, over to you.
Hi, Hemant. How are you?
Hi, Dr. Arun. Hi.
Hi,
Doing very
nice to
well.
see you. Okay, Hemant, I think it's excellent lecture as usual. It's a nice, crisp, nicely you summarized. Because it's a oncology participants. You have a good experience. Last two SAT-IT you did with oncology crowd. So can you just tell scientific writing how different you found in oncology? Is there any difference? What is your thoughts?
See, at the end of the day, Arun, the principles remain the same. It's about making modifications to catering to your audience.
Hmm.
Most of our papers were on ORIR, oncology, right? From real world settings. So I did not broadly find any difference. The same style that we used to follow for ORIR papers in other diseases, that is like TB, malaria, mother and child health, HIV, routine health system studies, we just followed the same principles. I didn't find much different, but for sure, subject understanding is key. Whether it's in TB, whether it's in HIV, whether it is in oncology, the understanding of the subject, having a hold on the area in which you're working helps a lot. But more or less, I did not find much difference. But for example, Arun, like when you're writing the settings, if your study or is in program settings, then you'll be writing how the program functions. But if you're writing about oncology and your paper is about treatment of cancer patients, then you're going to write in your settings how patient management is usually done, what are the modalities of treatments provided based on stage, and how the treatment outcome is decided at the end of treatment completion. So this is what you'll be writing in settings. If your paper is about, cancer screening, which is already happening on the ground, and you're going to use the secondary data from the routine cancer screening to answer some of your objectives, then in your settings, you're going to write how cancer screening happens and how, who does it, uh, who are your, target population for screening, so on. So it literally depends on what your topic is about. If your paper is around documenting the survival status, then in your settings, you're going to write how patients are followed up after treatment completion. Who calls them up? Is it based on their OPD visits? Or if they don't visit, who calls them up? What is the frequency? How data is entered? And how overall survival is documented? So it's the settings which varies, but overall the concepts are broadly the same. Over to you, Doctor.
Okay. Just for the participants, I just want to explain this tables and figures should be standalone. This has been like almost we have been hearing for every time we attend. Can you just tell them what exactly that standalone means so that a fresh new postgraduates also are there? So you can explain that to them.
Excellent. So in your paper, each table and figure should be standalone. What we mean by that is when a reader goes through a table, when he or she reads the title, goes through the body of the table and goes to the footnote, he understands what the table is about. He or she doesn't feel the need to read the narrative section to understand what the table is about. For example, the first table is about, baseline characteristics of patients with oral cancer registered in my clinic from 2009 to 2015, uh, Vijayawada, uh, Andhra Pradesh. Okay. Then table number 2, it should not just be treatment outcomes, right? We do this mistake. Table 2, say it is about treatment outcomes. We say we have already clarified who the study participants are in my table 1. So why do I need to repeat these details in my table 2? So in table 2, some people write table 2 treatment outcomes. But these are treatment outcomes among whom? Because sometimes you may not include all your study participants in your treatment outcome analysis. So again, you need to describe by time, place, and person the treatment outcomes of whom. Then you have the body of the table. And then if we use any abbreviations, if we use any technical terms and phrases in the title or the body of the table, they have to be clarified in the footnote. So each table and figure should be standalone. And I repeat, even the narrative should be standalone. So when you read the narrative, it should flow well and it should convey a meaning, even without feeling the need to referring to the tables and figures. Though for the sake of completion, we do mention, please refer to table 1, table 2, figure 1. Over.
Thanks, Hemant.
Dr. Hemant, there are 2 questions on the chat box.
Yes, please.
Can you please respond to that? You want me to read it out?
I can see there is difference between open access and closed access from author point of view.
Yes.
So, from author point of view, open access means, see, what we mean by open access is that for a reader, he or she doesn't have to pay anything to access the article. I'll repeat again. Open access means the reader doesn't have to pay anything to access the article, not the author. I'm saying the reader. So that means someone has to pay, right? So either the author pays a publication fee upfront, or very rarely the journal has funding to cover for all these things. So why we need these publication fees? Because the journal has some editorial staff in the background and they have a journal office. So to run those things, you need some money, right? Okay. So therefore, or when the article is formatted, there's someone in the background who does this. So if you make the article open access, that means I as a reader, when I see the article, I can download the PDF. but someone has to pay for the whole process that goes on in the background. Either the author pays it, or the author's institution pay in the form of publication fee, or the journal or the publishing house has got funding, to cover for all these things. For example, I know there is a public health journal called as Global Health Science and Practice. It is open access, so that means it's free for all the readers. And despite that, the authors don't have to pay any publication fee. The publishing house has got some funding to cover for their office assistants, their editorial staff, and their office charges. So, they are able to publish everything without the authors having to pay any publication fee and without the readers having to pay some minor amount to access the full PDF. Closed access from the point of reader means that for me to access the full text, I need to pay some amount as a reader. So mostly in this case, the author does not pay any publication charges, and the journal publisher of the journal earns money through this amount that the reader pays to access the article. And from that money, they run their publishing house or their editorial staff. They pay the salaries for their editorial staff. I hope I answered the question. Over.
Yeah, thank you, Dr. Hemant. Dr. Hemant, are you able to hear me?
Yes, I can. Over.
Can you just answer the next question? If they were just 2,000 words from my work, is it okay?
Excellent. If you're able to summarize your work in 2,000 words, excellent. Vis-a-vis someone summarizing it in 4,000 words. We say keep it short and simple. Keep it short and simple. Don't write for 4,000 words, 5,000 words. If your article just has one or two findings, it's easy to read. People will not feel lost when they're reading. And short word count means they'll be able to read the article in 5 to 10 minutes. So don't worry about, oh, my article, the findings are very simple, it's very short. The key thing is the relevance of your finding. How relevant are your findings, and what is the potential impact of your findings on policy and practice impact? Over. There's one more question that I can see, which is how to select journal for first publication. What points to be kept in mind? I would say the first journal should be a journal that is available on PubMed. As simple as that. Because you need to target publication, because as a young researcher, you want publications, right? In an ideal world, you can say, yes, I want to change policy practice, but you also want to publish, right? Even if you're not able to change policy practice by adding to the literature, you are adding to the evidence base. That if someone does WHO does a systematic review, or if some other senior researcher does a systematic review, the research would be part of it. So as a first researcher, I would say be wary of predatory journals. So generally, if a journal is available on PubMed, that means it will be widely circulated if your paper gets published, because PubMed is the first search engine that people go to when they go for literature search, if they want to search any article. So I think availability in the PubMed is good. And second is turnaround time. Look at turnaround time, because you want quick publications as a young researcher. Don't go for journals which have 1 year turnaround time. It may be really frustrating as a young researcher. So I would say these 2 points, because you want publications, and once you become more experienced, you can target for impact factor and you can target for other criteria. Over.
Thank you, Dr. Hemant. Any other questions from the participants? Okay. Then I think, Hemant, we'll just close this session. Thank you so much, Hemant. I think you have just covered the entire structure of the manuscript. I think the upcoming sessions would just add up to all in elaborate on each and every section. Thank you so much, Dr. Hemant.